Okay, so we're here today with Mr. and Mrs. Smedley with their pet Griff. And Griff has been a patient of this practice for a long time. And he's had stem cell therapy, so we're going to talk a little bit about how that procedure went and how Griff is doing. So, kind of what prompted you to consider stem cell therapy?
Well, we were looking at the stem cell therapy because of the arthritis that Griff has. He has been on Adequan for over 6 years, and the Adequan has been helpful.
Right.
But we've noticed in the last year and a half, Griff's been slowing down a little bit. He'll turn 10 this year. And we wanted to do something for him to kind of ease that pain
and before Christmas he was groaning a lot when he would get up or lay down. So he would groan, and you could tell he was just not as comfortable as he used to be.
Okay. So to clarify, he had some issues in his hip. It was mainly his hip that was the issue. So he had diagnosed arthritis in his hip. So when he had the stem cell therapy, tell us what you feel about the procedure, how it went. Did he come home? Were there any issues post the procedure?
I think the most difficult part of the procedure was the incision on his stomach. You know,
Okay.
that seemed to be the most difficult part, but it healed quickly and he was fine. He didn't bother the stitches. And
Right. So that's what we do with stem cell therapy, is to collect the fat, and then we collect the stem cells from that fat. So that incision is made in the mid-abdominal area. But it's a small, not a large incision, and then the procedure that day means that we then collect the stem cells, process them, and then in the afternoon those stem cells get injected into the affected joints. And he goes home, he went home the same day. So it's a nice, efficient procedure where they come in the morning, have the procedure done, and then go home in the afternoon. So after the procedure, he took a medication called Rimadyl to help with some of the inflammation. And the goal of stem cell therapy is to allow the stem cells to regenerate, which usually starts at about 30 days post the procedure. So the goal is for dogs with stem cell therapy is to wean them off these pain medications, and hopefully the stem cell therapy will continue to do what it's supposed to do for quite a while. So he is now we've slowly taken him off Rimadyl, gone from every day to every other day, and I think
now he's off totally.
he's completely off of it. And have you noticed any changes from when he was on it versus off of it?
Yeah, the change I've noticed is he's more active and sometimes gets in trouble with his sister.
That's a good thing.
Much more active. I mean, he's it's like the clock's been rolled back a half a dozen years.
Okay.
Like night and day difference from a few months ago.
And
Right.
he used to, when he would urinate, he would squat like a female dog, and now he's quite proud of the fact that he can lift his leg. He wants to
Yes.
christen every post and every fence.
That's very good. And those are, any groaning, any sign of discomfort? Do you hear that any more or less, or?
Minimally.
Minimally, and I think it's now more to get attention than it is from pain.
Sometimes that's the case.
Yeah.
That is the case. Well, Griff is a very good candidate for stem cell therapy, because what we try to do is not wait until they're very, very disabled, although it potentially could help dogs like that too. But he had a little bit of a problem, and I credit you to just doing it early and not waiting till he was really very advanced. And that probably contributes to his success. So, very good. Well, we're going to take some video outside and watch him walk around.